after cancer treatment, when the disease comes back or returns, that is called a cancer recurrence. It can happen in weeks, months, or even years after the original cancer was treated. And the major cause of it? Well, it can be tobacco.
There is a very high or a strong correlation between tobacco and cancer. There are two forms of tobacco primarily. One is the smokeless variety, which you normally retain within the mouth, and therefore you are very prone to oral cancers. And there is another variety, which is the smoking variety. And if you go on for a deep inhalation, you will actually deliver those toxic carcinogens deep inside the lungs. If a patient is suffering from cancer and the patient has actually taken all possible steps to come out of the disease and the patient is doing fine and is on follow-up, if the patient re-indulges or re-initiates smoking, then there is a strong chance that the patient will have a recurrence or relapse of the disease within a very short span of time.
Whereas it is important to understand that there are specific types of cancer for which tobacco use poses a higher risk of recurrence, while smoking is injurious to the entire body but harms some of the organs even more.
People who actually retain different kinds of the tobacco within the mouth, they're very prone to oral cancers. So you have cancers of the gums, you have cancers of the cheek, you have cancers of the tongue, so on and so forth. And then there are certain other cancers, for instance, the esophageal and the stomach cancers, the upper aerodigestive tract, as well as bladder cancers, which can increase with smoking. So there's a strong correlation. And if you re-indulge in smoking, there is a high chance of recurrence because you are once again taking in the similar toxins which probably led to development of some form of mutation in the body leading to cancer.
It is very essential for us to stop patients from re-indulging in smoking. They should completely quit and stay away from that kind of environment, as secondhand smoke can be as dangerous.
I think counseling the patient as well as the caregivers is very important because sometimes the patient might get carried away. But the caregivers are actually a solid pillar to the assistance of treatment to cancer for the cancer patients. There's some amount of nicotine, which is a strong component of smoking, that actually goes into the body, actually adapts the body with some form of nicotine on a daily basis, but at reduced levels so that sooner or later, once you stop it, your body will not be able to face the withdrawals in terms of nicotine. So this is a gradual weaning from nicotine by giving some form of nicotine replacement therapy. There are nicotine patches, there are nicotine tablets. This, along with counseling, forms a part of the nicotine replacement therapy. There are many young women and many young men who are actually now suffering from lung cancer, but they have never ever smoked in their life. So, but they were probably victims of passive smoking. So this is coming up in a big way. So it's a moral responsibility, a social responsibility. You save yourself, you save the people around you.
Impose a lot of restrictions on yourself, it's time to take adequate precautions